So today we'll talk about systems of control. The idea is, how do you control the spread of this virus? So in terms of how do you control, one simple answer is you find treatment for it. There's two ways of treating it. One is curing it, so the person has the virus and you get rid of it, sort of like how you get rid of bacteria and pneumonia with antibiotics. And the other way is preventing the virus from getting to the person in the first place, usually what people say when they mean vaccination. For cure, right now, we're focusing just on people who are dying, who are on the ventilator, people who are very sick. If it's successful, then we prevent them from dying. The goal is to actually move it forward more and prevent people from getting so sick. For example, if we diagnose your cancer early, we could hopefully prevent it from spreading. If you have stage 4 cancer upon diagnosis, sure, we have some chemotherapy that'll give you a month or so longer to live, but it's not that great, right? You get an extra month. Isn't it better to prevent it from getting it so bad in the first place? The second way preventing the virus is about immunity, herd immunity. This is what all this talk about antibody testing is about. We want to see who can't get it again, because if they can't get it again, then they can't be a host. So a virus needs a host because it can't reproduce itself. It needs those human cells that are the factory for it to reassemble itself into more and more viruses. So if we have herd immunity, if enough people got it and have cleared it and have antibodies, or people have vaccines and have responded, then there wouldn't be enough of a population for the virus to continue to spread. So if you look now practically at sort of two different strategies that different countries around the world have used, I would say you would have to look at the testing strategy that South Korea is known for and the quarantine strategy that China is known for. I think most people have to agree that both of them are very successful. So South Korea's strategy is testing everybody and anybody. So if you meet the criteria, you get it for free. A doctor referred you, you have contact with an affected person. Otherwise, you pay for it, but it's something like 130 bucks. So not something unaffordable. And they made it simple, called drive-through testing. I think America was the first country that had a drive-through, but they've taken it and run with it. And so you just pull up in your car, they'll swab you while you're still sitting in your car, and then you go on your merry way and they'll give you the results within 24 hours. Pretty simple, right? In terms of capability, sure, people like to say numbers as in how many tests per million people, but I think just think about in terms of practicality. They had an outbreak in February in Daegu. The city said it would test everybody, even without symptoms that belonged to the church. Because this church was just sort of a great way of spreading it. People would sit on the ground apparently for hours holding hands. So by March 10th, they announced that they tested almost everybody. 10,000 people. Isn't that crazy? I remember even last month, so this is, February, which is 2 months ago, but even last month, the US basically, they had criteria for testing. And we all knew these criteria were stupid. They weren't criteria as in who should get a test. The criteria is set to limit tests people did. They made it harder for doctors to order tests. You had to fill out all this paperwork. And the reason wasn't that they thought this was necessary. The reason is they want to prevent doctors from filling out paperwork, so they would not order tests because they just didn't have the ability to order tests, to do testing. So the criteria initially was you had to be hospitalized. This was back in the beginning of March. You have to be hospitalized. That means you have to be very sick. If you come in contact and you're asymptomatic, nah, we're not going to really test you. If you think you have it, can you prove it? Can you prove that you were in contact with somebody who got tested positive? Oh, unfortunately, sir, we can't test you then. It was just stupid. It was ridiculous. We just weren't doing testing because we couldn't. And I remember I used to see them saying something like, they got a grand total of 4,000 kits or something for California. Like, great. So you have a state of 30 million people and you have 4,000 kits? Very good way to start things out, right? And the other thing Korea did was they also used technology in terms of contact tracing. So, they had an outbreak before and they learned their lessons from the Middle East respiratory syndrome. And so they were going to do a lot of tracing for people. And they have a lot of ways of tracing your phone already, right? We do it in the US too. Mainly it's known for advertisers doing it. But they have other ways of tracing you, and they could say, hey, this guy tested positive. Let's see where he has been these past few days, and they'll broadcast it so everybody nearby can know, hey, if you were here, you might have been in contact with somebody who has it. Obviously, there are outcries of privacy and this and that, but I think it's more important to sort of figure these things out so people don't die. I think most of South Korea agrees as well. The other strategy is the Chinese strategy. And so there's nothing close to this in the Western world. Italy has something maybe, but it's not the same. Because in China, when they say you can't leave your house, they really mean it. And you can see these videos of them welding the gates shut. And so when they mean you can't leave, you can't leave. So, it works. I don't think anybody disagrees it works. They think there's a high price to be paid for shutting everything down literally. And so in the US, we have a sort of in between measure. We have stay at home, shelter in place. If you wish, sir, ma'am. Yeah, you could go out for essentials, but the problem is essentials is a very nebulous term. In some states, marijuana is an essential, so they're allowed to stay open, meaning people come out just to get their marijuana. In some states, guns are essential. Actually, I think most states. So you could go out to get your gun or your ammo. But what about grocery stores? So you could go to a grocery store, you could touch stuff, you could put it back, other people touch it. You could hand your cash to the cashier full of coronavirus. She'll take it, give you change, get coronavirus on herself. Next customer comes in with clean cash, but the cash he gets in return has coronavirus. It just sounds like a bad idea, right? My strategy is follow a way that works. I don't know that you should modify it when we just don't know enough. We don't know a lot about how the virus is transmitted. Last month we weren't sure. Is it droplet only? Could it be aerosolized as in the air? Do you need an N95? Do you not? There's just so many unknowns. And when you have a lot of unknowns, I say, why don't just take a strategy that works and go with it, right? I mean, if you look at countries which have had success, they've sort of been on the stricter side. They've done a lot of stuff early. But yeah, I mean, the US, we think we're better than everybody else. So we got to do it our way, right? It's my way or the highway. That's an American song, I understand. And so the CDC wanted to do their own test. Everybody else's wasn't good enough. Well, guess what? They didn't get it right. Isn't it better to have something that works that isn't the best than to have something that doesn't work and have nothing? I would agree that might be a little bit better. You can improve on it later, but shouldn't you have something right now instead of being woefully unprepared? The next thing is strategy. How do you play this game? Is it like a chess game where you make a move and the opponent makes a move and you can tell right away whether you made a good move or not? The problem is you don't see the result right away. That's something we learn in engineering. It's called feedback. When feedback takes too long, when there's too long of a delay, the system is not stable. We have a similar sort of thing in the medical field called warfarin. It's a drug that works as a blood thinner. The problem is the level changes sort of days later. And the level changes in response to every single little thing. You get a sniffles, huh? The level goes up or it goes down. Take a medication, new medication level goes up or it goes down. So we check your levels frequently because the levels change. But we also know that we may change something today, but you're not going to see the result till at least a few days later, which makes it a pain dealing with it in the hospital when we check the levels every day. Normally in the clinic, they check it maybe once every few weeks, maybe once a week if you're really bad. But in the hospital, we check it every day because we're doing so many things that change it. But we also know that the levels aren't reflective of what we do today, tomorrow. They may be reflective 2 or 3 days later. There's a lag. So the question is, well, the levels are too low. We got to make it go up. Do we just give them a lot more today? But we already gave them more yesterday. So often I have this discussion with the pharmacists, right? Because they're afraid of overshooting. Maybe give them too much, and then 2 days later they're actually too high, and that's bad too. Well, they develop a newer test called chromogenic factor 10. It's a much more responsive test, and you see changes before your INR, which is the standard test. I think that's what we need for this game called coronavirus control. We need something that sort of changes much more quickly. And then we can see a result in a matter of days rather than weeks or months. Right now, we're doing a change and we see, okay, let's see. Cases, yes, cases are going up. Deaths, okay, yes, they're going up. Okay, after a few weeks, yes, that was probably a bad decision. A few weeks, a month, I think that's a little bit too slow, right? But how do we get such data? I could only think of one way, is we just have so much testing. And we can see the effect of our changes in policy, of distancing, right away. Massive amounts of testing. And I think that's one thing that seems to be much simpler right now than to work on a cure. A vaccine takes a long time. Treatment has been elusive so far. But testing, we should be able to come up with much more rapid ways of testing. Lots of companies are working on it. I think they can produce the supplies much quicker than coming up with treatment. See, treatment is complicated, vaccines are complicated because we have to make sure they don't do harm. Testing, we could evaluate how good it is pretty quickly and just ramp up production. Have multiple companies make it. See, when we think about things that we do tests for, like say diabetes or blood sugar, it's not just one company. Sure, they're not perfect, they're off by a little bit compared to, say, the hospital results, the blood levels, but it's good enough. So just make it a free for all these companies going for it all at once. Capitalism at its best, right? Isn't that how we solve the rest of our issues in our world?